Hi, everyone. Thank you for taking time to attend this seminar today. I mean, it's a pleasure and honor to be here, and I am grateful to Dental CE Academy and Dr. Rawling for organizing this informative seminar. Today, we will discuss about this important topic about mastering post-operative care, infection-free and faster healing. I am very excited to share some important strategies to improve post-surgical outcomes in a clinical dentistry. Today, we will cover ways to prevent infection and speed up healing, both which are very crucial for a patient recovery. Thanks again for being here, and my goal is to make this session very informative and interactive. So I encourage everyone to please participate in the discussion as we move along. Dr. Rowling has given enough introduction about myself, so I just want to skip that for a moment. The learning objective for this course is defining the causes of the post-operative infections and their impact on dental practices. What are the different ways to reduce infection risk and save on costs through better post-operative care? How specific clinical solutions can speed up healing and prevent complications? Identifying the simple ways to integrate these care into the dental clinical settings, and recognizing the financial benefits when we apply those strategies into a dental clinical practice. Just a disclaimer for everyone, this continuing education is sponsored by S2 Ocean. I am currently serving as Chief Scientific Officer for the company, and I'm also currently having a financial relationship with the company. So, what are post-operative complications? So in a broader perspective, as per the scientific literature, complication is a disease or a disorder arising from a consequence of another disease. So in a better way, post-operative complications in dentistry are unexpected issues that arise after a dental procedure, impacting the recovery process. These post-operative complications can range from minor problems like swelling and discomfort to more serious problems like excessive bleeding, delayed healing, or space infections. So understanding these potential complications is very essential for dental professionals to ensure patient safety and achieve the best possible treatment outcomes. In dentistry, especially for the clinical point of view, the post-operative complications can be categorized into three main types: infection-related complications, procedural-related complications, and environment-related complications. The infection-related complications include issues such as localized infections, swelling, pain, bleeding, dry socket, systemic infections, or abscess formations, which can arise when bacteria enter the surgical site. The procedural related complications, these complications stem from the dental procedure itself and may involve dental operator related complications like applying excessive force during tooth removal, nerve damage, improper prosthesis technique leading to implant failure or fracture or crown fracture. And also there is a third kind of post-operative complication, which is environmental related. And this category includes factors like operatory hygiene, air quality, aerosol management, and so on. So poor operatory hygiene or inadequate air quality also play a big role in creating post-operative complications. However, in this presentations, we are entirely focused on infection-related post-complications in clinical dentistry. The learning pathway for this presentation is following the understanding the post-operative infections. What is the impact of the post-operative infections in clinical practice? What are the causes of the post-operative infections? What are antibiotic-associated complications? How to prevent the post-operative infections? Key benefits of adapting post-operative care, how to integrate these practices into your clinical dentistry, and then we'll conclude this presentation after question and answer. So what are post-operative infections in general in terms of dentistry from an operative point of view. So a post-operative infection occurs when pathogens such as bacteria, viruses, or fungi invade surgical site during the procedure, after a procedure, leading to any cardinal sign of inflammation like pain, inflammation, pus, and other signs of infection. And these infections may occur at early stage, intermediate stage, or a late stage of recovery. And they are often arise due to poor wound healing or failure to maintain oral hygiene, and also if a person is immunocompromised. But out of all these three factors, the poor wound healing and the improper oral hygiene compliance plays a major role in related to post-op infections. Now, delayed wound healing is the number one cause for post-op infections. Why? There's a reason for that, because the oral cavity presents a unique challenges when it comes to post-operative complications in dentistry. Oral cavity is a home to millions of bacteria, viruses, fungi, forming a complex and dynamic microbiome. And this environment can complicate healing and increase the risk of infections following dental procedures. I mean, oral cavity is the only site in a human body which has to heal in a moist environment, even surrounded by the microorganisms all around it. So, the longer the healing process, there will be a greater opportunity for bacterial colonization, which can lead to higher infection risk. And as everybody knows, like wound healing is a sequential process. There are 4 stages of wound healing, from hemostasis, inflammation, proliferation, and remodeling. And especially the first and the third stages of wound healing, hemostasis and proliferation, the chances of getting bacterial colonization is very high. Clinical studies have found that delayed healing is the number one cause for infection in patients post-extraction. I mean, the prolonged the healing time directly correlates with the higher likelihood of bacterial colonization. I mean, there was a study published in 2022, a recent study that mentioned that how the delayed healing in dental surgery impacts the infection rate, a very good readable study. Another important aspect is the type of the oral care product we use. I mean, alcohol-based mouthwash irritates the wound. It creates a irritating atmosphere. The healing tissues, the healing cells get disturbed, and hence it delays the healing process. And because of all the burning sensation, altered taste alteration, even the compliance is very poor. So it depends upon the product as well in the healing process. The common dental procedures where the chances of post-op infections are really high. The number one is tooth extraction, particularly our wisdom tooth. Extraction, there is a 5 to 10% chances are higher of getting a post-op infection after a third molar removal because of the proximity of the anatomical locations, as well as challenges in maintaining the proper oral hygiene, inaccessibility for proper brushing, inaccessibility for proper flossing. So there's a multiple factors that plays into that role. Dental implants, I mean, 30% of the dental industry is now revolves around dental implants. And in every second day, a dental implant is placed. But if you go by the statistical scientific numbers, the chances of implant failures are increasing from historical data. And what's the reason for that? Because of the peri-implantitis, because of the bacterial proliferation around the implant surface, make it very viable for colonization, and hence leads to an early failure of dental implants. So that's the 2 main procedures which really are greatly impacted by the post-op infections. This is a very interesting study recently published in 2021, and they mentioned that out of all the dental operatory procedures, dental extraction is the most frequently carried out treatment in any dental operatory. It's a global assess of different clinical studies. And out of various complications associated with the tooth extraction, delayed wound healing is the number one complication associated with the tooth extraction. So we really have to put a very great emphasis on that. Like if we are going for extraction for a patient in our dental clinics, so delayed wound healing is going to play a major role. So we have to be very diligently careful in handling those patients. Another aspects of the patients having systemic conditions, for example, diabetes. Diabetes plays a major role. I mean, if a patient is diabetic, so the chances of getting infection rate is almost 8 to 12% more higher. And these infection can result from mild to moderate inflammation and even to severe emergency situations. Uh, in cancer patients, that's also very interestingly coming with a greater number. Like right now, 18 million people are cancer survivor right now in the US, and these numbers are going to be projected around 26 million by the end of 2040. So imagine giving a clinical care for all those patients who are totally immunocompromised and needs a special care during their healing process. And that's we have to really very careful while handling the cancer survivors in our dental clinic. Now, when we talk about the different types of post-op infections, these are basically categorized into two types: early onset infections and late onset infections. The early onset infections occurs within 72 hours of a dental procedure and mainly associated with the bacteria while introduced during the surgery itself. The late onset infections usually happens weeks or even months after the surgical procedures, and this is often linked to the poor oral hygiene. And why the poor oral hygiene? It's basically related to the poor compliance of the oral hygiene. And why the poor compliance of the oral hygiene? Because of more alcohol and chemical based products that brings burning sensation, irritation to the mucosa, and that's why people don't want to maintain those kind of oral hygiene procedures in day-to-day routine, and that leads to the post-op infections. Now these infections, another aspect is superficial incisional infections. These infections are confined to the incision or surgical site. I mean, this typically involves the skin or mucosa and occur within the first few weeks of the surgery. And the key symptoms are like the cardinal signs of inflammation, redness, swelling, heat, and tenderness. And these infections are most commonly seen while putting implants, not the abutment, but the crown part of the implants. Second is deep incisional infections. So these infections extend deeper into layers tissues beyond mucosa. And the key symptoms are discharge of pus, the clinical main feature if you find persistent pain, swelling, and discharge. After bone grafting and the implant procedures, especially after putting abutments, you can see these kind of incisional infections. And lastly is the organ and space infections. So their number is very low in a dental operatory in terms of the incisional and the superficial infections. And these require beyond the immediate surgical site. I mean, it's a really serious condition, severe pain, purulent discharge, and it can involve infections into sinuses or bone structure. So it's really a serious threatening condition, and that requires medical attention as well. So, but the chances of having the space infections are really less in terms of the other post-op infections. Now, let us discuss what are the impact of these post-op infections. So post-op infections can have a significant impact beyond the immediate health concerns related to dentistry only. I mean, these complications not only affect patients' recovery, but also introduce several broader challenges. I mean, these challenges include like financial burden, operational burden, patients' dissatisfaction, long-term systemic effects, and even the legal risks. So let's discuss each component a little bit more in detail. Financial burden. So, I mean, imagine treating a post-op infection can cost dental practice between $400 to $600 per patient. And that's a huge amount if you think about, because all these costs from additional appointments, extra clinical materials used, and sometimes prescription of antibiotics. In a larger dental practices where multiple offices are there, so we can observe there's an annual losses of 15,000 US dollar annually. And because managing these complications arising from infection can enhance the overall cost of a dental procedure by almost 10 to 15%. There is a recent study done by Maddox et al., and they mentioned that how the financial impact of the post-op infection impact the clinical financial aspects of a dental office. And it's a very good clinical read, and I highly recommend you to read that article in detail. Second aspect is operational burden. Now, dental practices, if you have higher number of post-op infections, you have to reschedule the patients who experience post-op infections, definitely. So it will disrupt your daily workflow. I mean, if you imagine yourself in mid of the day planning to put an implant in a patient, and then you receive a call into your office like, I'm having pus discharge, I'm having fever, then really you have to take that call of action, and you have to call that patient, and you have to postpone your implant surgical procedure. So it disturbs the daily workflow of a clinic. And with a study, it was done, and it has mentioned that there's a 20% decrease in throughput. So when throughput means the whole process and the systems get delayed by 20% around the day because of dealing with post-op complications. So 15 to 30% more time per patient you have to dedicate if the patient emerges or if the patients have post-op dental complications. Third important aspect is long-term health risk. I mean, the post-op infection, it is not only confined to the dental cavity only or the particular dental socket where we have done dental procedure, but it can extend below that dental operatory and can introduce and can include your systemic health as well. Complications such as osteomyelitis, bacterial endocarditis, preterm low birth weight, scenario in case of pregnant women, airway obstruction, sinuses infection, and so on. So 7% of the post-op infections can lead to systemic health disorders. So that's a huge number, especially if we are dealing with the vulnerable population, if we are dealing with a cancer survivor, if we are dealing with a diabetes patient. So these numbers will go further higher. So it is very important to understand that post-op infections not only confined to the oral cavity, but systemic health as a whole. Another aspect is legal and reputational risk. I mean, there are instances when patient can sue a dental practice if the negligence is related to dental operatory in creating that post-op infections. So it is very important to diligently take care of the post-op infections so that we don't have to deal with any lawsuits and to unnecessarily dig ourselves into attorney fees and so many on. These are the never-ending stories with the legal lawsuits. And another one of the aspect of, I forgot to touch that, the clinical reputation itself. If you have higher number of post-op infection cases, then through social media, through word of mouth, so you get a kind of like a pushback of your dental practice. And sometimes it is hard to gain new patient as well as to retain the old patient. So it is very important to understand that post-operative infections are totally no good for social reputation point of view. So now understand what are the common causes of the post-operative infections. So the number one is bacterial contamination, 100%, because dental cavity or oral cavity in any particular time of the day, you can find 700 different kinds of bacteria, fungi, viruses circulating inside your mouth, saliva sticking to your teeth, gums, and so on. But because we have the good bacteria and the bad bacteria, so they will not cause any harm. But still, there is an existence of variety of kind of bacteria inside our mouth in form of biofilm. So nowadays, dental plaque is considered as biofilm. And why biofilm is a challenge in dentistry? Because dental biofilm is made up of microorganisms such as bacteria, fungi, viruses that are surrounded by matrix, protein polysaccharides, as well as genetic material. So it is very hard for oral rinses, oral rinses, and toothbrushing to remove that biofilm. And also because of the unique properties of the biofilms, such as physiological heterogeneity, where they can have multiple microorganisms in a very small distance, but with a different variety. So it is difficult to manage them. Quorum sensing, the art of communicating bacteria within the oral cavity, within the biofilm, makes them very unique. And also the biofilm is antibiotic resistant. So the alcohol-based mouth rinses does not work on biofilm. So the only thing that can work in order to mitigate the biofilm is if you have a higher number of good bacteria in your oral cavity. According to a research data and a study by Fugu et al., bacterial contamination is responsible to 60 to 70% of the post-op infections. And the key organisms, as we know, the key organisms which are present in pathogenic organisms in the oral cavity are Aggregatibacter actinomycetum comitans, Porphyromonas genevalis, Priotilla intermedia, Tenarilla forsythia, Fusobacterium nucleatum, Peptostreptomycros, and Campylobacter rectus. So these 7 organisms play a very significant role in catching the infection to the surgical sites. So without proper sterilization and infection control measure and a strong and a natural oral hygiene measure to populate the good bacteria, it is very hard to manage the biofilm. Surgical technique, the another important factor that plays important role in causing post-operative infection is poor surgical techniques, such as inadequate irrigation, uh, pre and post procedural rinses to be done before the surgery. And if the surgical time exceeds 90%, 90 minutes, then there is threefold chances of getting infection rate. So it is very important we as a dental professionals to concisely and proficiently manage the surgical site as early as possible to minimize the risk of post-op infections. Poor patient compliance. Another factor that can play a very big role in post-op infection is poor patient compliance. Studies have shown that 40% of the patients fail to adhere to post-op instructions. Why? Because there's a reason for that. Because when they are instructed to use alcohol-based mouthwash, chemical-based mouthwash, they feel irritated. The surgical site is not calm. The healing tissues are not calm, and they get irritated. And then, as a response to human body, they start avoiding using the mouth rinses. And what happens? The pathogenic microbiota increases in the number, and then that invade into the surgical site and increase the chances of post-op infections. Oral care products, as I mentioned, the type of the oral care products play a huge role what kind of and the outcome of your surgical procedure will be. Alcohol and chemical-based oral rinse. I mean, there are studies that mention that if alcohol and chemical-based mouth rinses are used, it reduces the healing rate by 20%. Imagine 20% out of 100 patients, 20 of the patients will get compromised because of the post-op infection, and that's not your fault, and that's the fault of the oral product. But in this era of social media and social links, the patient is not going to blame himself or herself. They will say that I gone to XYZ dental office and I got post-operative complications. So it is very important to understand the right oral care product to refer for patients. Delayed healing. I mean, the oral cavity studies show that delayed wound healing is the leading cause for post-op infections. And as we discussed just now, delayed wound healing gives more opportunity for the bacteria to invade to the surgical site, and hence there are higher chances of bacterial colonization. It provides a breeding ground for bacteria and infection to persist for a longer duration of time. Hence, delayed healing is the number one cause of post-operative complications after tooth extraction. Now, the patient-specific factors. This is also plays an important role in causing the post-op infections. So, if the patient is compromised, if the patient is diabetic, definitely it's nothing related to your dentistry, but it's higher chances of getting infections. If the patient is cancer survivor, and we already know that there are 20 million survivors right now, going to be 30 million another 10 years. So we have to take diligent care. We cannot rely on patients. So we have to make the post-op instructions, the post-op oral care products so naturally synergized into their system so that they can not feel challenged about using them. Now I want to touch upon important topic about antibiotics or prescribed, because we believe that there is a one solution to fix this post-op infection is by giving antibiotics. Widespread use of antibiotic is there. I mean, despite this strong evidence, it has been shown that antibiotics are unnecessarily referred and prescribed in dental procedures. 80% of the dentists in a particular region, as per the study, has prescribing antibiotics to each and every patient coming to their dental clinics with no clear sign of infection. Because of this, there is another threat and problem that's a global public health threat now, antibiotic resistance. I mean, more than 2.8 people in the US becomes infected with bacteria that are resistant to antibiotics, and 35,000 people die each year. That's a huge number, a very huge number, kind of a scenario created by ourselves as a healthcare professionals. And if we do due diligent in antibiotic prescribing, we can mitigate this situation. It's a common practice when we are on the healthcare side. I'm giving antibiotics just in case. So the just in case attitude really makes antibiotics prescribed so frequently that it enhances the antibiotic resistance cases so much globally. I mean, it is not necessary to give antibiotic prophylaxis before surgical procedure unless it's in high risk patients. The high risk patients such as having uncontrolled diabetes mellitus, having cancer survivorship, and if he's on the active treatment, and if he has another medical associated complications, which you think he is taking immunocompromised drugs and their chances of getting infections are higher, then only we can prescribe antibiotics. Otherwise, there is no need to prescribe antibiotics if there are no signs of infection and inflammation. Even the recently American Dental Association has also issued a guidelines when and how to prescribe an antibiotics, and I really encourage everyone to visit to that ADA website and get an insights on that, because it's a huge topic itself, and I can't cover it in this presentation. 40 research state that a recently study in 2019 by Palmer et al., like 47% of the antibiotics prescribed in dental procedures are unnecessary. Even simple procedures like routine extractions, we don't need to prescribe antibiotics. They can be very well managed by proper hygiene and a good oral rinse. So I'm again and again emphasizing the advocacy of good oral hygiene products, because the good oral hygiene products make the patient proper compliance to use them. And if they have a strong compliance, then the results are very good and they don't have any post-op complications. This is a very good study in this study, it is published in 2000, I think, 16. And this study is very great in terms of understanding, do you really need antibiotics? So in a placebo group and in a control group, there are 75 patients in each group. One group receives, 75 people receive antibiotics after extraction, and 75 people receive placebo, no drug. And surprisingly, when they review the data after 3 weeks or 4 months of study evaluation, they found that both the patient have the same number of complications or same number of without complications. So there is absolutely no need of prescribing antibiotics if the patient is healthy and the patient is fit enough after a routine dental extraction. And as we know that dental extraction is the most commonly done clinical practice in a dentistry. Consequences of overprescribing. I mean, definitely we are putting so much emphasis on this topic because we are creating super bugs in this ecosystem. And that's why when you have new viruses, new bacteria, it is so hard to create vaccines for them. It is so hard to create so much mitigating factors for them because these are new emergence. So the scientific literature doesn't have any cultures and media to understand them and how to control them in a timely fashion. So it's very important to understand and due diligence required in prescribing antibiotics. One of the biggest complications which now associated with antibiotics or prescribing is patient safety. And that's a big deal. Clostridium difficile infections. I mean, this is often lead to results in severe diarrhea and even cause to death. I mean, if you go by numbers, you will be surprised to see that 5 million becomes infected annually with CDI infection, and while 30,000 die each year. Of note, definitely, these are antimicrobial resistant, and about 1/3 deaths are due to antibiotic resistance. So it's a huge issue, and if we take due care while prescribing antibiotics, we not only help in building a strong ecosystem for the overall microorganisms in the environment as well as the human body, but also prevent the post-op infection by thorough post-op instructions as well as maintaining due diligence during operatory care. Now we'll touch upon what are the effect of post-operative infection strategies. What are the effective strategies? So in this section, we will explore the effective strategies for managing post-operative complication in dentistry. We will cover prevention techniques to minimize the risk of infection, including proper sterilization protocols, patient education, and post-operative care. So let me discuss each of the component in a little bit more detail. Basics of all the clinical protocol. Pre-operative rinse. I mean, if you do a pre-procedural rinse, it significantly reduces the bacterial load. So this is a kind of a gold standard and a regular follow-up. And check-ins with the patient, like within 24 hours or 48 hours, it will make a huge difference in reducing the post-op complications. So these 2 points are the gold standards if you really want to put the numbers down for the post-op complications. Second is oral care products. And it's a key factor in compliance because avoid oral care products that contains alcohol, chemicals, preservatives, colors, dyes, sugar, and so many things because these products do more harm than good. I mean, they not only irritate the tissue, but also disturbs the normal oral microbiome. And as a result, due to disturbance of, or you can say that excessive killing of the good bacteria, the bad bacteria numbers grow significantly larger, and then it delays the healing process by bacterial colonization and invasion into the surgical site. So that's why natural oral care products such as sea salt based rinses, sea salt based toothpaste has shown to prove effective results in post-op infections. Studies demonstrate that sea salt based oral care products promotes healing. And why they promote healing, we will just look into that more details as we move along. Patient education. I mean, this is one of the important aspects if you really want to control the post-op infections, because by fostering open communication and providing clear information how to take control of yourself post-operatively, we can enhance patient compliance and ultimately improve outcomes following dental procedures. So if the patient is well informed and has well equipped with the knowledge, there are 50% less chances of getting post-op infections. So that's a huge number if we are able to manage that through a proper education as well as by giving the right time of education. Now we will discuss how we can integrate these steps for post-operative infection control in dental clinics for patient safety and recovery. There are 4 key steps which we will discuss in detail. Number 1, comprehensive instruction for patients. Provides patient with easy to flow instructions. Clear post-operative guidelines really help them to understand the importance of the post-op infection control. It significantly reduces the risk of infections up to 60%. Give them a comprehensive written guidelines. Don't rely on giving short information. Give them a detailed information. Give them educational resources. And to that note, because if you don't give them educational resources, they will do their own Google search, or they will do on their internet search. And internet is a funny thing. You have a good information, you have a bad information, because you don't know the source of the information. That's why it is important to give patient the right information material and the right links to follow the post-op infection control. There's a study where mentioned that it's a big study where 1,700 patients mentioned that if they are giving a thorough instruction in post-op infections control, how to maintain their oral hygiene, there's a very significant positive outcome in the oral hygiene maintenance. Second is right selection of the oral care products. I mean, it really supports the oral hygiene. Number 2, it balances oral microbiome. I mean, as we discussed, there's a bad bacteria, there's a good bacteria. Both of them are present in the oral cavity. If we ask patient to use an alcohol and chemical-based mouthwash, it will kill both, the good and the bad. And as a result, you have a compromised oral cavity. That's why we want to supplement the patients with the right oral care products that are natural, that are mineral enriched, and that aligns with the human saline system, so that they can not destroy the good bacteria, but can only take care of the harmful bacteria, so that the good bacteria growth populate and overcomes the bad bacteria growth and maintains a healthy microbiome. And also, definitely, it has no side effect as well. And again, I really want to stress on that avoid chemicals and colors in the post-operative compliance for the patient. Endless results, not recommended, because number 1 reason, as we discussed, it disturbs the oral microbiome. That's not good. And also, it disturbs the normal microflora. There are studies that said that there are delay and disturbance of wound healing when alcohol-based mouth rinses are prescribed to patients after dental procedures. So what is the solution? So solution is by adapting natural oral care products. So natural oral care products play a valuable role in post-op infection. Products made with real ingredients like sea salt offer antimicrobial and anti-inflammatory property without harsh effects of chemical-based alternatives. These products maintain the delicate balance of good bacteria in the oral cavity, promote healing, and reduces the risk of infections. Sea salt, it's thousands-year-old remedy. It's one of the gentle and the safest formulation which you can advise to a patient to use as a post-operative oral care, even for the daily oral care. It promotes healing. Why? Because there are natural salts, there are natural minerals in that. It's a mineral-rich biological support that you are providing. You are nourishing the healing cells with the right amount of minerals so that they proliferate well and they grow well. And also, it will help the good bacteria to repopulate more in the oral cavity. There are studies that mention that how they are able to maintain a good xerostomia after having sea salt based mouthwash. It reduces inflammation and swelling. The hypertonic nature of the sea salt really drains out the excessive fluid from the inflamed tissue. And that's very important in order to reduce swelling and inflammation. The pH is well balanced. So it's a difference between maintaining a well balanced pH for a longer duration of time rather than just for having for a fraction of second. It has a natural antimicrobial action, and if the sea salt is further combined with any other additional ingredients like lysozyme, xylitol, it further enhances its function. So it's a natural antimicrobial action without any side effects. There are studies that shows that when you have sea salt balled oral rinse, it improves healing process and oral hygiene among diabetic patients after oral surgery. So imagine these are the diabetic patients. These are already 2 times more immunocompromised. So if they have a better result, so what about a non-diabetic patient? So you will have an excellent healing results after using sea salt based oral care products. It's always backed by science. And there's a studies done by different authors around the world that shows that how it is important in creating a balanced oral microbiome and supports natural healing. There are different studies that mention that how oral cavity play a significant role because, as we discussed, there is an microbiome, and that is very much necessary to maintain a good bacteria, and that can only be maintained if the good bacteria is supplemented with the right amount of the minerals, as well as the right amount of the pH and the right amount of environment where they can repopulate and overpower the bad bacteria. There are different studies. Very important to understand why sea salt is so important in today's world of oral care. But it is also very important to understand every salt is not sea salt. There's a huge and ton of difference. So as per my up-to-date most knowledge, red sea salt is one of the most mineral-rich sea salt that is present in the world today. And because it has 80 plus elements as compared to sodium chloride or table salt. So if you're thinking about like, okay, let's prescribe our patient with a home table salt based sea salt rinse after surgical procedures, no, it's not going to work because table salt is weak, inefficient, and not mineralized. So it's very important to recommend the right sea salt, and if you can find the red sea salt based products, that's the key to go. Another important aspect for managing the post-op complication is follow-up monitoring and appointment scheduling. Maintain a thorough checkup with the patients within 24 hours. Timely intervention can save post-op infections to a greater deal. And definitely patient compliance plays a major role, and we have to really put efforts on educating patients in order to have a better oral care compliance. And lastly, use technology. I mean, today is the world of AI and everything is connected to AI. So give them automated reminders about taking post-operative care of their surgical sites. Teledentistry, use the function of teledentistry. Give them advice, take informative educational lectures once after you're done with the surgical procedure so that you cannot disturb your daily operatory of the dental surgical procedures, and then you can handle those patients in education and guiding them after your routine clinical working hours. And that's why you can have to really work on improving the post-op infections. So in this concluding slide, I can say that the key takeaway is that post-op infections are a major concern, and we have to really very diligent about that. Patient education and proper oral hygiene plays a very big role in order to maintain a good oral hygiene and to prevent post-op complications. Antibiotics should only be used when it is required. Do not overprescribe antibiotics with a slogan of just in case. No, we have to avoid that, and always stick to natural oral care products such as sea salt based rinses, sea salt based mouthwash that can reduce the risk of infection and promotes faster healing. And with this note, I thank everyone for being so much attentive and being present to this seminar. And I am very much open now for questions and comments. You can also reach out to me through my email, or I will encourage everyone to connect me through LinkedIn. And I am more than happy to get engaged. If we are not able to take your question today, I will definitely follow up with you. Thank you so much.
I'm going to help you with these, Dr. Sani. Okay, we have a few questions, and they're great questions, everyone. Thank you. Question first one, is chlorhexidine helpful for post-operative healing, or will it cause healing delays?
The studies have confirmed that if you use chlorhexidine mouthwash, it will delay the wound healing by 20%. So I will not recommend using chlorhexidine-based mouth rinse at all, especially even after these surgical procedures.
Is a controlled diabetic at increased risk for infection?
Definitely, diabetes is always an factor to be considered while dealing with post-op infections, and you have to really do a diligent care. But if it is diabetic is 100% controlled with the strong HbA1c levels, then you can go without antibiotics as well.
Okay, we have quite a few people asking about where they can get the sea salt rinses. In just a minute, we have Mr. Eddie Kolos, CEO of H2 Ocean. And also, if you tap on that blue banner at the top of the screen, you can submit a request to get more information. But I urge you to stay on for a few minutes and learn more about their products, because you'll get most of your questions answered about what product. Next question here for you. Can we rinse the socket with saline solution in order to prevent post-operative infection?
It depends. Every saline doesn't work. The saline made with sodium chloride only has 2 elements. So every saline is not the same. So if you have a red sea salt based oral care products or a mouthwash that you can use and soak your socket and cavity. So don't believe on every salt. Don't believe on every sea salt. Believe on the quality and the elements, how many minerals are present in a sea salt.
Why are there so many failing implants after a few months of placement? We irrigate with diluted clindamycin before placing the implant.
The reason for that is because of the poor patient compliance. The patient, you do a good irrigation, but what about the patient? He's not going to use alcohol-based mouthwash for long duration of time because it causes them burning sensation, taste alteration. So we really have to rely upon those oral care products that really serve the purpose of mineralization, proper healing, and as well as a natural antibacterial properties. That's why I always recommend to go for natural oral care products such as sea salt based oral care products.
We see sorry, I'm trying to understand this. Is Norton's table salt any good for rinsing, or just sea salt labeled salt?
No way. Modern sea salt is not an health grade salt that can be used on the wounds because it has no properties, just a table salt. So you have to be very diligent about what kind of salt we are using, especially after dealing with the post-op infection control. So please stick in understanding why red sea salt is important.
How many days do you recommend rinsing with sea salt after 24 hours from surgery, and how often per day?
I usually recommend after surgical procedure to rinse at least 3 to 4 times in a day, at least for a week, and then followed by 2 times a rinse. It's a daily rinse. You can continue throughout your lifetime because you don't want complications in your mouth. Neither you want any biofilm to get attached to your mouth. And that's the reason. And also, most importantly, you want a healthy microbiome. You want a good bacteria in your mouth to fight the bad bacteria. And that's why you have to continue using the natural sea salt based oral care products.
What about patients that are hypertensive, Dr. Sani? Is there an issue with using the sea salt rinses?
No, because these are used externally. We are not going to indulge or we are not going to ingest the mouthwash, right? So it doesn't matter if the patient is hypertensive or not, because these are using superficially and it's not going to disturb their hypertension levels anyhow in any condition.
Okay, question about what the best over-the-counter sea salt rinse is. If you hang on for a couple of minutes, you'll be finding out more information. Favorite post-operative rinse, again, if you stay on, there'll be a presentation on H2 Ocean. I find it may be difficult for patients to find red sea salt. How much is regular sea salt a compromise? Again, stay on a few minutes. Why do most surgeons still use chlorhexidine? That's a very good question. They're all good questions.
There's a reason. Yeah, I appreciate this question, because the reason for that is that because new science is coming, new emergence is coming. Now, if you go to any grocery store near you, you can see sea salt based ice cream, sea salt based chips, sea salt based chocolates. Why so? Why they are not available 10 years back? Why they are not available 20 years back? Because at that time we don't have more science backed products. Now everything is sea salt based, and that's how the whole medical industry will be changed, and there will be more natural oral care products that are based on clean ingredients, and natural sea salt will be the number one leading the way for the healthcare based products.
What about oral probiotics, Dr. Sani? What's your view?
Yes, oral probiotics play a good role. Definitely, oral probiotics can be used in a different ways in order to repopulate the good bacteria. But remember, oral probiotics work for a very small portion of time, because if you again rinse with the alcohol-based or a chemical-based mouthwash, then those oral probiotics that you are taking, they got killed. They get killed. So what is the purpose of using probiotics if you are not supplementing them with the minerals? You have to feed the bacteria, the good bacteria, with the right minerals. There are 80 plus minerals which are present in the ocean. And if you can feed those minerals to your good bacteria, then that's the way to go to maintain a good oral health.
What do you believe in terms of a good pre-operative rinse? Also the same?
Yes, 100% same, because I don't want to burn the oral cavity before I start the surgical procedure. 100% natural red sea salt based oral care products.
Everyone, I do have the passcode on the screen, 720437. Please write it down. I encourage you to stay on for a few minutes to hear from H2 Ocean about these products and the amazing research that they're performing and what they are producing in terms of science and publications that Dr. Sani is very much embedded in right now. So please stay on. And for many of you that don't know, I am a Clostridium difficile survivor that followed a simple extraction of number 3, and I almost died. So this is really near and dear to my heart, because you don't want to lose a patient or a wife or a husband ever to C. difficile. And it's really incumbent upon us to look at our prescribing practices. I thank you all for being here again. And also please stay on here for a few minutes. We're going to take the code down. We'll also have it in the chat area. Please comment about Himalayan pink salt.
Himalayan pink salt, the thing is that it's extracted through using heavy machines. So you have iron component in much more level. So you have to take care of the sea salt, which is hand harvested, unrefined, and in the natural form. And that's why red sea salt plays a bigger role as compared to any other sea salt available in the market today.
Thank you very much. So again, the code is 720437. I'm going to put that in the chat area. Dr. Sani, thank you so much for your information this evening. I want to remind everyone that you do have a copy of his presentation in the course folder. The last slide is his contact information and LinkedIn. Reach out to him. I do every day. He's going to respond with your questions. And let's go ahead, and anything you'd like to say, Dr. Sani, before we bring up our next speaker.
Yeah, I really want to, stress that believe in natural dentistry, believe in natural oral care products, and try to avoid chemicals, alcohols, preservatives, and all the, the bad stuff into your mouth, and try to stick towards a more nature And 70% of the human body is water, and the earth is 70% is water. So try to use those substances that are extracted from this mineral rich component of sea salt. And you will learn with this presentation why the sea salt is so important.
So we're going to go ahead and provide you with some information, and then we're going to have the CEO of H2O Ocean get on here with us and go through some Q&A, and you can ask your questions. I encourage you to stay on. Again, at the top of the banner, it's the blue banner, excuse me, and if you tap on that, you can be taken to their information and request more information. So here we go. Fingers are crossed, Dr. Sani.
Welcome to the fascinating world of H2 Ocean, where science and nature meet to create cutting-edge products using the power of sea salt. Behind these walls of innovation, our team is dedicated to advancing health and wellness through natural ocean-based solutions. Let's dive into the journey of how H2 Ocean is revolutionizing care, backed by research and driven by the healing properties of the sea. I am Eddie Colos, the inventor, formulator, and CEO of H2 Ocean. Established in Florida, USA, we pioneered the use of sea salt-based products in healthcare. With over 32 products across various categories, distributed both in the US and internationally. Our commitment to excellence has earned us awards for Entrepreneur of the Year because of our success globally. And we're not just about business, we're also deeply committed to the ocean conservation. At the heart of every H2 Ocean product is sea salt from the Red Sea, the world's most mineral-rich sea salt. This is hand-harvested, unrefined salt, contains over 82 trace minerals, naturally aligned with the human saline system. This unique composition is what sets our products apart. We uphold the highest standard of quality, the gold standard. Our products are patented, cruelty-free, and manufactured in the FDA-registered facilities under good manufacturing practices. We are made in the United States, and we are assuring that we stay the forefront of sea salt-based healthcare and always do our part in recycling all of our packaging. We are committed to continuous innovation and development. We started off in 2002 with our piercing aftercare spray. It's the very first piercing aftercare spray in the world. But one of our flagship products also took off in 2004, which was our healing rinse product. It is our mouthwash that we felt that was a need for all the people that believe in saltwater rinses. We continued in wound care, vet care, nasal care, first aid line, tattoo aftercare, and soon we will come out in 2025 with our all-natural toothpaste for sensitive teeth, whitening, and also benefiting people with dry mouth. Now let's focus on one of our flagship products, the H2 Ocean Healing Rinse, the world's first sea salt-based mouthwash. What makes this product so special? Well, key ingredients. The red sea salt, which is enriched with 82 trace minerals and hand-harvested and unrefined. It's perfectly matching the human's body's saline system. Another ingredient, lysozyme, an antibacterial enzyme that enhances the immune system's protective function. Also found in our saliva, our tears, milk, and sweat. Xylitol, a natural sweetener, approved by the FDA and widely accepted by the dental industry for its oral health benefits. Also, diabetic safe. The benefits of our sea salt mouthwash offers us excellent results for various oral health issues, including dry mouth, bad breath, post-extraction care, implant hygiene, and daily oral care. It's safe for all ages, including diabetics. It contains no dyes or alcohol, no harsh preservatives or fluoride, artificial flavors, or added sugar, and does not sting or burn. Some of the key questions in saltwater rinses. Which salt is the best to use? What is the ideal salt to water ratio? What is the mineral content of the salt? How was the salt processed? What is the purity level of the salt? How do I use the salt water to rinse or gargle? What is the purity level of the water? There's also sea salt versus table salt. Which one's better? Think about it. Would you rather be taking 82 trace minerals, or would you rather be taking 2 trace minerals, sodium and chloride? Which one do you think is going to balance your body the best? Red sea salt is unrefined. It's evaporated and sun-dried. It's the only real organically harvested salt in the world because it's surrounded by deserts. Ours is USP grade. Table salt, no question. It's chemically refined and processed. Table salt also is heated to extreme temperatures, produced commercially, has an environmentally impact on the earth. It comes out brown sometimes, and then they chlorinate it to get it to appear white. H2 Ocean mouthwash isn't just a product, it's scientifically proven solution. We have conducted extensive studies on its effectiveness in treating gingivitis, dry mouth, dental caries, and promoting surgical healing. It has been tested for safety with diabetic patients and for orthodontic hygiene. These studies' results have been published in reputable scientific journals. Did you know not only that I was the formulator and inventor of H2 Ocean, I'm an author. I wrote the book on the science of sea salt with Dr. Rajiv and over 70 plus international professors from around the world in 30 different countries. These are all medical professionals that had something to say about the science of sea salt. This textbook is packed with over 500 pages and will be distributed to universities and colleges around the world. Why choose H2 Ocean? H2 Ocean has become the #1 post-dental care mouthwash for surgery, orthodontic, and implant. We offer excellent patient compliance with our cleaning with healing approach. Our product comes in 2 natural flavors, Arctic Ocean Mint and Lemon Ice, and also 3 different sizes to suit various needs. 64 ounce for maybe your patient room for post and pre rinses. 16 ounce should last your patient maybe about 1 month if used once or twice a day. Or an 8 ounce that's easy to travel with. All of our mouthwashes come with a 3-year shelf life. Let me now talk to you about our partnership opportunities. For dental professionals, we are asking you to partner with H2 Ocean, offering both clinical success and financial growth. We have 2 main partnership programs, the wholesale partnership and the affiliate program. The wholesale partnership program offers significant discounts, allowing partners to generate additional revenue. For example, our 8-ounce bottles have a MSRP of $10, but we are available to sell you those bottles for just $5, offering you a 50% profit margin. The affiliate program. This is a flexible, zero commitment program that allows partners to earn without any overhead costs or inventory hassles. It's simple to get started. And what it is easy to sign up on our website under the affiliate program at the bottom of our page. Create the account, set up a checkout page, either on your tablet or on your personal phone. This will offer your customers either buying bottles by 1, 2, or you can even put them on a subscription pay, which is coming soon too as well. The tap to pay option will allow you to grab their credit card and tap your phone and have all their information and ready to be checked out, where we will ship out to your patient within 2 to 3 days for their post-procedure or their daily use. This will then give your customer a 10% discount and also give you 10% of the sale that you will also earn. It's simple. Your partnership can earn you additional income of about $13,000 annually based on referring 100 new patients each month. Here's a chart that will show you generating by 100 new patients each month or however long it takes you to get to that. But assuming they might have other people in their family that like using this mouthwash. We have the test and try with the 64-ounce pump bottle. This is designed for the dental offices. In each clinic room, you can have one of these bottles for your pre and post procedures. This will allow your patients to get used to the product that you're referring. Start using natural sea salt healing rinse instead of the chemical competition that is out there in the market that contain dyes and alcohol and other harmful added ingredients. You could scan here to explore the partnership opportunities with H2 Ocean. Now that you know a little bit more about our company, I invite you to go to h2ocean.com and sign up for our newsletter to get updates of our latest offers and discounts, and also to find out a little bit about what our news and testimonials that we have. Here is Dr. Chad, the former president of the ADA, talking about our H2 Ocean mouthwash. I would like to introduce you to some of our customers and our industry partners. We were Amazon's choice for the #1 sea salt mouthwash. We also create the CVS brand for a sea salt mouthwash. Walmart.com is now also offering our products, and we support the Navy Exchange. Our prices are low, so we don't want anybody giving any more discounts. So you won't have any other discounted marketplaces that you will compete with. Thank you for being part of this presentation. We would like to know a little bit about your comments. You can email us at info@h2ocean.com or call us at 772-219-8183, or just visit our website, h2ocean.com. Please scan or click here if you would like any more information. Now I will have time to answer some of your questions.
Okay, we have a few questions here for you, Eddie, and thank you for being here. Everyone, Eddie is the author, inventor, and CEO of H2 Ocean. Many of you have been asking, where can you get these products? Well, you're looking at the person that invented, and he's here to answer your questions. You do have his presentation in your course folder. I also see quite a few of you went to the blue banner at the top of the screen. If you go there, you can request more information as well. Question here, so you should not use Himalayan sea salt?
Yes, good evening, everybody. Thank you also for having me. I'm very excited to have sponsored this and also have Dr. Rajiv also as one of our scientific researchers. We've done very extensive research on this product, but let me tell you, Himalayan sea salt, it's not from the sea. So that's misinformation. I would throw it away. I'll tell you why, because it is in the Himalayan mountains. One side of it is made in China. The other side is made in India. They're both racing to cut this mountain up just so that they could put it out in the marketplace, because it's a big hype right now. So just like Dr. Rajiv said, there's tons of heavy metals in there from the machinery that they use, like iron. If you look it up, also there's some lead in there, and it can take a little while to get toxic in your body, but you never want to have some heavy metals that continually to build up in your system, because you'll become toxic and get ill eventually.
Thank you. Question here, do you have to shake the 64-ounce bottle each day?
No, not at all. This is a diluted solution. We use the highest pure USP grade water, and basically it's a clear solution, no shaking needed.
Would this be appropriate for irrigation for scaling and root planing and periodontal procedures?
Yes. In fact, it's just great to even have patients that are maybe diabetic, or like we say, cancer patients, maybe use it, a week before, just to actually start good hygiene and the good flora into the mouth before they go through any kind of implants or any kind of surgery.
Eddie, what age groups would this be used for?
All ages. I mean, we had a baby that swallowed a whole bottle one time, and I had my phone number on the back of it, and it's a true story. Nothing happened. The mother was really concerned, but I stayed on the phone with her and I said, there is no poison in our product. So I don't think, maybe even loose stools might happen, but that didn't even happen because we don't use a hypertonic solution. We don't have too much of something that might be toxic.
What about for women that are pregnant?
It's safe as possible on pregnant women too as well. It's safe to swallow. It actually could probably calm the stomach.
I think this question's for me. What happened to me after number 3 was extracted and I had C. diff? How did I manage? Hospitalized 4 times, did not respond to 4 rounds of antibiotics, lost 35 pounds, almost died, had a fecal transplant that saved my life 2 years ago. And that was from a dental procedure and antibiotics that I didn't need. So I'm happy you're all here today, and I'm happy that Dr. Rajiv discusses that with you. It's important. I'm from the seashore of the Red Sea. I know the sea salt is amazing. We even use it since fishermen sell it $1 for 25 kilos of salt. Interesting.
Well, that's a very good price.
Could we use Hawaiian sea salt?
Yes, you can. Hawaiian sea salt is great sea salt. Just, some of the sea salts might be packaged in commercially grade kind of, cardboard. That's why I don't like Morton salt. Just read it where it's actually the certificate of origin or where it's from, because some are labeled sea salt that are actually from lakes, like the Dead Sea. The Dead Sea is a lake, or even Utah. The Salt Lake, Utah, they will call it sea salt, but it's false.
What is the next step for someone that is interested in the affiliate program and the other programs that you have, Eddie?
Well, that's really, we have a brand new website, which is a Shopify website. And I think what is going to make a lot of dental offices, they can get into this affiliate program by signing up on our website. Once we accept you as an affiliate program, you'll be put into a third-party affiliate program, which will actually give you how much bottles you sold. And then you can actually take and download just the checkout page on your Apple phone or your smartphone, and it should go into a tap to pay. So if you're, recommending it right after your patient is done, still sitting in the chair, you could have this product shipped to them within 2 to 3 days as a drop ship. We'll get the orders. You'll already have the payment going in through your phone through a tap to pay. Take the credit card out, just tap it on the top or the bottom. It will put the information of where it needs to be shipped to. You could sell 1 bottle, 2 bottles, the different flavors. We'll also have a monthly subscription on there. And then you'll start earning some of that 10% of every sale that you make. And I think it's a really great program. Nobody has done this program. And it's something that we're just launching actually today. So we had this new website built. We were really excited about this program, and we're going to continue it. And hopefully we get a lot of dentists that don't want to carry a mouthwash, which they're not really big on selling any products anyways. They give out free toothpaste or free, a toothbrush. So we do recommend having the 64 ounce, in the office, maybe have a couple of bottles, because, when people get really interested in a good, healthy product, they're going to want to come back. And if they can't find it in any of the stores, they're going to be constantly coming back into your office or going back to that linkable website or our website, and then they'll be using your code, which you could give them the code, or your code will already be there. All you would have to do is kind of put your code into the little box there, and then you will earn that 10%.
Great, thank you. So I do want to remind everyone, please tap on that banner at the top of the screen to get to that form. And also you do have a copy of this presentation in your course folder. Any other questions? I think we've got through most of these questions. It looks like all of the questions. Lots of great webinar, great comments for you, Dr. Rajiv. So yay, good deal. And
thank you.
This video was awesome. All of it was awesome. I was really honored to have you both here this evening and be able to teach our registrants about natural products to treat post-operative infection and help prevent infection. And let's try to mitigate for C. diff and all of these other antimicrobial resistant infections that we're creating with our prescribing practices. Any other things that you would like to say before we go ahead and end the meeting, Eddie or Dr. Rajiv?
Yeah, I would just love to say that, we're going to continue doing this. There is so many different uses for our product. This is where we want to start. But with all the clinical data and the research that we've done, my goal in my heart is to actually help people that are cancer survivors, because we know how hard it is if you do get that notice where you have cancer. Now, what do you do? Nobody really tells you what to do. And we're going to help out in other ways too as well. We had, Florida get hit with this hurricane, and we'll be giving out as much as we can. So we like to give back. I'm an ocean guy. I have over 30 years of experience in skincare, natural skincare. And you can't imagine, 22 years ago, bringing up sea salt was going to change the world. And we're really excited to see what this can do, even in the future, more and more that people learn about our products.
Terrific. Thank you so much for being here. Dr. Rajiv, anything you'd like to say before we tell everyone good night or good morning?
Yes, I want to add a point that, believe in natural oral care products, which are science-backed. Take an informed decision. Just go through the scientific backup and just go with the flow of time and what's changing in today's world. So in today's world, we are always looking beyond organic. Now we are looking upon clean ingredients. Now organic is an old term. Clean ingredients, natural products is the way to go. And that's how we are positioning ourselves to give one of the most natural oral care product available in the market today. And we will keep on putting our efforts to make this really happening till the time we achieve our goal in making the dentistry a very safe and a synergistic product towards
Terrific.
human health.
Thank you so much. We'll go ahead and tell everybody good night. Thank you all for being here this evening and for staying on. Please reach out to H2 Ocean and learn more. Good night now.
Thank you so much.
Thank you. Good night.